Hi, Jay. It's David out of Olympia, Washington. Just listened to your media episode, your excellent ending comments on the net cost of healthcare and the profit motive. Um, I don't know if I'm adding anything to the conversation, but maybe just a different way of explaining some of that. Yeah, there's the profit. So there's in a perfect world, the amount that in aggregate everyone paid in premiums would equal the amount of healthcare that's purchased in aggregate on anyone's behalf. Some people are going to cost more, some people are going to cost less, but in average that should be equal. The amount we pay in premiums is the amount of healthcare that gets purchased on behalf of all of the people that have a premium with that country. So first of all, there is overhead, and a well-functioning system should be able to run on 3 or 4% overhead. I think if Medicare runs on 2, bully for them. But in the existing for-profit healthcare system, that overhead number runs closer to 15 to 18%. And that's because of the overlapping coverage, the practice of, denying coverage and, sending it in for appeal and saying, well, it's not our coverage. This other insurance company should be paying for it. Oh, we don't do lab expenses. We only do the procedures. You have to go this other way. And so all the finger pointing and the crosswalk of getting medical expenses paid is incredibly inefficient. So it's not 18%. It's, 20% profit plus, 15 to 18 minus the 2% for Medicare. So it's like 35% more expensive. So there's 35% slop compared to an even system where, you just process the payments and you pay for the healthcare that's consumed. In terms of perverse incentives, the real peril that I think about is real estate agents. They make a fixed percentage of the price of the house. So, 3% of like nice round numbers, maybe you're buying in the nicer part of Seattle, but 3% of $1 million is $30,000 commission. And what incentive does the real estate agent have, especially at the margins? They could negotiate and work real hard for you to get that price down to, $950,000, $925,000, but it would take a lot of work, and they're actually reducing their commission for all that extra work they've put on your behalf. So there's no incentive to work really hard to keep those prices down. There's a certain amount of, they are supposedly negotiating on your behalf, but they'll, put in maybe a competitive bid, but they're not going to really work the system to get that price as low as possible, as if they were actually working in your best interest. And that same sort of perverse incentive applies to insurance agencies. Anyhow, Jay, as always, stay awesome. Thanks a lot.